welcome to Scotland's Health Research and Innovation Conference. It's a real privilege to be here today, and it's lovely to see so many of you gathered for what I'm sure is going to be a fantastic day, celebrating 50 years of advancing healthcare. The theme of today's conference reflects 50 years since the Chief Scientist Office of Scottish Government was inaugurated in 1973. And of course, this year also marks 75 years of the National Health Service. And these milestone anniversaries share so much in common: a commitment to continuously adapt and innovate to meet the changing needs of our patients and communities, and importantly, an opportunity to recognise the ongoing talent, skill and commitment of all of you, the enablers of innovation. But this is also much more than a number and much more than an anniversary. This is about using today to reflect on accomplishments and recognise the individuals, ideas, studies and programmes of work that are shaping research, development and innovation in the NHS today. It's also an opportunity for us to look forward towards a reimagined, transformative future and the opportunities to accelerate science-driven innovation to support NHS recovery, all the time delivering better care for people in Scotland. And of course, this is vitally important. Demand for healthcare services continues to rise, and the NHS is under unprecedented pressure. Backlogs from the pandemic, pressures from respiratory infections, and the increasing burden of chronic disease, all of which have been exacerbated by the cost of living crisis. We know that it's difficult for patients and very stressful for staff, and we know that things have to change. Of course, significant work is already underway. The NHS Recovery Plan, published back in 2021, set out our key ambitions and actions to be developed and delivered now and over the next 5 years. It evidences research, innovation and the redesign of services as integral to the recovery of the NHS, alongside the adoption of new technologies to support improved access to healthcare. Also in 2021, the UK Vision for Clinical Research was published. Titled Saving and Improving Lives, it set out a bold and ambitious vision to bolster the delivery of clinical research across all phases, all treatment types and all conditions. Achieved by embedding clinical research at the heart of patient care across the NHS, making participation as easy as possible, and ensuring that all health and care staff feel empowered to support research. The Life Sciences Vision set out how the sector can work together to solve some of the biggest healthcare problems of our generation, including cancer, dementia, mental health, obesity, ageing, respiratory disease, and the need to capitalise on the opportunity from vaccines. And the National Innovation Strategy lays out the blueprint for Scotland to become one of the most innovative small nations in the world, with health and life sciences a priority focus. These strategies and plans are all important because they form part of a collective, united effort to build back better and to support the NHS in delivering cutting-edge healthcare for patient benefit. And today, I think, is testament to the progress being made. We've got close to 500 today, or in our audience today, researchers, innovators, healthcare professionals, policymakers, public involvement contributors, and participants in health research. All of you are critical to how we recover from the pandemic and shape an NHS that is fit for the future, one that drives prevention, early intervention, and reduces health inequalities and supports improvements in health outcomes. I want to take this opportunity to thank all of you for your resilience and commitment, particularly over the last few years. We're also grateful to have more than 60 speakers from across the country, bringing their insight, expertise and learnings to us in topics varying across medicine, data and AI, clinical trials, and work to enable greater participation and public involvement in our research. It's fantastic to see the strength and diversity of activity underway across Scotland. And I want to extend a very warm welcome to our international speakers. Professor Tan Cho Chuan, who's Permanent Secretary for National Research and Development and Chairman of the Agency for Science, Technology and Research in Singapore. Dr. Victor Zhao, President of the United States National Academy of Medicine, Vice Chair of the National Research Council and Chancellor Emeritus of Duke University, and Professor Sir John Bell, Regius Professor of Medicine at the University of Oxford. These esteemed members of the Chief Scientist Office Scientific Advisory Board are leaders in global health innovation and policy. Their extensive knowledge and insight into healthcare innovation will help us to compare and contrast activity here in Scotland and to look for opportunities to learn from each other. This is an invaluable opportunity for two-way exchange, and being outward-looking and open to new ideas is going to be critical as we carve out the next 50 and the next 75 years. This is a real collaborative effort, and driving meaningful conversations with diversity of views and experiences is important. So I'm also delighted, excuse me, to be joined by many of my colleagues today, who will be hosting what we hope will be some very lively panel discussions with opportunities for you all to get involved and ask questions. And then we'll be spending some time this afternoon considering the next 50 and 75 years, looking at how our infrastructure in Scotland is evolving to maximise scientific and technological innovation, and how we can unlock the full potential of our workforce and strengthen our partnerships. And importantly, we're looking at how we do this through a collaborative whole system approach across all 14 territorial health boards that will enable us to maximise the precious resources and funding we have available and to ensure that no one's left behind. What is clear is that we are united in our ambitions to improve healthcare, to lead to longer, healthier, happier lives for the people we care about, and the exciting possibilities to bolster Scotland's research and innovation capabilities. The opportunities for our relatively small nation are huge. We still manage to punch above our weight on the international healthcare map. Thinking differently and innovatively is in our DNA. Scottish-led healthcare innovations include MRI scanners, ultrasound and antibody therapies. These discoveries originated in Scotland and transformed healthcare globally. And in the modern day, our triple helix collaboration between the NHS, academia and industry, all working in partnership, is advancing innovation at a pace we've never seen before, touching on all areas of healthcare. We have clinical trials running the breadth of this country. Those trials span all therapy areas: cancer, diabetes, cardiovascular, stroke, dementia, mental health, and much more. We also have exciting innovation projects involving data, artificial intelligence, medical devices, drones, and digital tools, and we'll be hearing more about those during the day. These research and innovation projects are truly exciting. They offer multiple benefits to both our patients and to the NHS system. They offer the opportunity to accelerate diagnosis and early intervention, reduce waiting lists and times for results, improve treatment, ensure equity of care, deliver a better patient experience and improve clinical productivity. Those are the outcomes that we want and need to see in a modern and sustainable health system. So today we've got the chance to discuss and plan for healthcare needs for successive generations and what delivery of that might look like in the years to come. I'm confident that Scotland has all the attributes to be a destination of choice in health research and innovation. We must capitalise on our existing strengths: our single NHS, our renowned universities, our world-class medical experts, our high-quality electronic health data and established collaborations, and underpin this with a culture of new, invigorated, innovative thinking. If we all work together, then huge progress can be made. And of course, healthcare is complex, but if we can get all the cogs in the machine turning as one, then meaningful change is within our grasp, and the strong foundations of a more productive, efficient, innovative and healthier future will have been built. So for now, I thank all of you here today and those of you who aren't in the audience today personally, but who make such an important and valued contribution to our collective efforts to drive forward a more modern and sustainable NHS. Research, development and innovation are all key pillars of our NHS recovery, and I am really inspired by the strength and diversity of the work being showcased here today. It engenders confidence for the future and begins to write the story of innovation across the next 75 years. So I wish you all a really enjoyable day, full of learning and thought-provoking insights. And I am delighted to introduce our Chief Scientist for Health, Professor Dame Anna Domenica. Thank you very much.